We're continuing with public affairs programming here with a local look at issues and topics important to the Long Beach community. This is Focus on Issues on KFRN 1280 AM. My name is Suong Tran. Today's guest is Gail Daly. She's the CEO of St. Mary Medical Center. Gail, thank you so much for coming on the program.
No problem. I'm glad to be here.
Well, St. Mary Medical Center is one of two major medical centers in Long Beach. Can you give us a brief description on what the medical center is?
Well, we're a 389-bed licensed facility, and we have we're a level 2 trauma service. We have Women's Health Center, a cardiac care center that includes open heart, a maternal child health program for obstetrics and pediatrics, a rehab center. That's actually a 40-bed unit that we have that's been in operation for over 30 years. And we are a center for the treatment of obesity. We actually have a designation of Center of Excellence. And our highlights are that we've been in the top regional hospitals in the U.S. News and World Report in 2010 to 2012. And our medical center is ranked in the top 5% for emergency medicine excellence. And we are unique because we're the only disaster resource center that has an island airport and port under its jurisdiction, meaning that we are a receiving center for Catalina and the port of Long Beach. We've been affiliated with the Sisters of Charity of Incarnate Word since 1923, and we're the only Catholic hospital in Long Beach. And we provide services to over 50,000 patients annually in our emergency room. We deliver over 3,000 babies annually as well. And we've been known for our community mission and our charity care, which on an annualized basis results in approximately $36 million in services that are rendered either through education or direct care management of the community.
Okay. And you said that you're a level 2 trauma center. What does that mean?
A level 2 trauma center is a designation that allows you to take specific patient populations. We are able to take, for example, gunshot wounds, multiple vehicle accidents, and MVA. We're not licensed for pediatric trauma, so that type of trauma service would go to another organization that has the level and designation for that. And I did forget to mention that we were a STEMI receiving center, and what that is when a patient is in the field and has an acute heart attack, they're brought in, and in the event that we've diagnosed that it's actually an ST elevation, which is a specific indicator, we initiate our call team, and we have an interventional team on site immediately to revive the patient to prevent any heart disease or heart trauma injury to the patient who may or may not have had a heart attack.
Okay. Let's move on now and talk about a new program that you have that is directly helping Long Beach residents.
Well, it's our Breathe Easy mobile outreach program, and it's in a partnership with the St. Mary Foundation, the St. Mary Medical Center, and the Port of Long Beach. And it's a fully equipped mobile unit that will be able to go out into the community to address respiratory disorders within the community, to provide individual respiratory health action plans and education for patients who may or may not have allergies, have asthma, have emphysema, or chronic obstructive pulmonary disease. So it's a way to get into the community and on the behalf of the port related to pollution-identified respiratory diseases, so we can eliminate the impact that pollution has to these particular populations within a specific zip code. And the area in which we cover ranges from Ocean Boulevard up to the 710 and up to Del Amo. And that corridor there is where we actually are working towards serving the community.
Yes, I do remember doing some interviews with the American Lung Association and the South Coast Air Quality Management Board and other agencies that have done studies on this, and people living in the downtown area where the ports are located. I know that they're at high risk of developing asthma and other respiratory problems, but it actually goes, as you said, up to Del Amo in the more affluent areas of Bixby Knolls, Los Cerritos.
Right. And that is actually when we provided the grant proposal to the Long Beach Port Commissioners, that was one of the areas within the grant that was an expectation that those community members would be able to have access to this type of clinical access and educational program that could actually just be brought to their doorstep. And a lot of, the community members have access issues. Either they have, limited access to physicians or healthcare services in general, or they have limited access to transportation. And the other thing is what the mobile clinic allows is the ability to go out into the community, educate the residents, educate the family members, so you can get an adherence to the patient care regimen. So you're not having a patient who's not, treating themselves medically appropriate, meaning that they're not compliant with their medication regimen or they're not compliant with their respiratory exercises. All of those things are what the mobile clinic can provide. It can provide, an extension, basically a physician service and an educational service right into the community.
Okay, so I'm sorry. So what medical services can be given out through the mobile clinic?
Well, there's a variety of things. We have we have the basic tests that we do within the mobile clinic. We do a full assessment, a full screening assessment that includes respiratory and pulmonary because, of course, they do go hand in hand. We look for any comorbidities such as diabetes, CHF, anything that could link to the overall state of health of the patient. And then we provide follow-ups if in the event that we screen someone who has a positive need for a referral for a healthcare provider, such as a primary care physician or family practice physician. Once we've done that, then if they need advanced testing, of course we're not doing advanced testing in the mobile clinic, but we have the ability to navigate them to St. Mary, and we provide radiology services, pulmonary function screening, and a variety of cardiopulmonary tests in the event that that's needed.
Okay, so are the services offered through the mobile clinic free?
The services through the actual mobile clinic are offered free. That is something that the grant covers. And then we have other means in which we've been fundraising and identifying ways to ensure that the patient who is referred for the workup, because the grant covers the educational portion in the screening. And so if the patient or the resident needs additional, intervention, we don't want to just, let them out in the community without that follow-up. So we have a plan to address, making rates that would be acceptable to the patient or payment plans, or finding donors that would be willing to support those types of services for patients who are underinsured or underserved within the community.
Okay. So is the mobile clinic out and about in the community yet?
It will be out in the community in April. We're currently waiting for the Department of Health to fully license it so we can operate within the community as a mobile clinic. That's actually, the Department of Health allows us to provide patient care services. Without that, you really, you're in violation of the regulatory requirements.
Will you have the dates posted on your website as to where the mobile clinic will be and when?
Yes, not only will we have dates posted on the website and on our social media network, Facebook, but we also will have the information in the local media, in papers published, in flyers going out to those zip codes, and the schools and the churches, the senior housing centers and parks that we plan on having a scheduled routine service. They'll get a calendar that's updated, and that will go out well in advance of the event to make sure that it's communicated so we have, the ability to capture as many people in the community as possible while the van is there. Okay.
Well, we were talking earlier about the concern of asthma and respiratory problems for people living around the port area. Since St. Mary's is serving that community, are you seeing a lot of patients coming to your medical center with asthma or other respiratory problems?
We see a significant amount of patients with some type of respiratory disorder. It's probably one of the top 5 admitting diagnoses that happen in the hospital. Now, I couldn't certainly tie it back to soil pollution. I mean, there are patients with active pulmonary disease, but any of the things that you can remedy, pollution that doesn't activate an exacerbation of someone's asthma or emphysema or chronic obstructive pulmonary disease, then that's a benefit with the clinic.
And why is early detection of asthma or other respiratory problems important?
Because your lungs are very delicate. When you continue to insult, them with disease or injury, they become scarred. And when your lungs become scarred, their capacity to take a breath in and to exhale a breath out becomes more and more restricted. And when that happens, when you're not allowed to, when you can't get enough oxygen into your lungs to oxygenate your blood, your heart starts working harder. And it affects a lot of different things when that happens. You get high blood pressure, you can get kidney disease, you can get heart failure. So it's really important. Your lungs are, the most important thing in your body that needs to be maintained. Without airway management, you can't, you're unsustainable for life.
And did you say earlier that your medical center approached the port with this idea?
No, the port had some funding available, and they basically, presented to the community opportunity to obtain funds that they had with regard to pollution and helping the community deal with pollution. And with that, we proposed to them to have access to funding over $800,000 for a mobile clinic that we thought would be the best way to transport the message for the air pollution and limiting air pollution in the community. So we really thought that the use of those funds, if you're really going to do an outreach in the community, you really have to go to the community. To have the money just be donated to St. Mary and have the patients come to our campus, there would be a lot of individuals we would not be able to render service to. So it was the idea that having a mobile unit out in the community, better serving the mission of the port and always serving the mission of St. Mary was the best way to go.
Okay. So how many people do you think the mobile clinic will serve?
Well, we're estimating around 22,000 units, and what that means is contacts. So it could mean 22 new patients. It could mean 20,000 patients, and of those, 2,000 are recurring. But we're anticipating 22,000 units of service that we will render over the course of the next 12 months.
Okay, so is this just one van that this grant is providing?
Yes, it's one van. We have an exam room. We have a education area or room. We have a laboratory space in the area. It's a fairly roomy environment where you can see 2 to 3 patients at a time and be doing various activities. So it's not just a one patient goes through the van and that's the only capacity that it has.
Okay. Well, we're at the end of the program right now. Let's give out your web address so people can learn more about the things we've talked about.
Okay. Our web address is www.stmarymedicalcenter.org. www.stmarymedicalcenter.org.
Okay, so it's www.stmarymedicalcenter.org.
Perfect.
Okay. Why don't we give out the main number for the medical center? Is that okay?
Sure. The main number for the medical center is 1-562-491-9000.
Okay, and we've been speaking with Gail Daly. She's the CEO of St. Mary Medical Center. Gail, thank you so much for coming on the show.
You're welcome. Thank you so much.
Again, to learn more about St. Mary's Breathe Easy mobile outreach program and their new 38-foot custom mobile care clinic, you can go to their website, www.stmarymedicalcenter.org. That's Saint, abbreviated as ST, marymedicalcenter.org. You've been listening to Focus on Issues, a public service program for KFRN 1280 AM. The opinions and the views that you've heard on today's show are those of the participants and do not necessarily reflect the opinions of the staff or management at Family Radio.